Gentlemen and ladies, I wish to announce the arrival of the Commissioners and TSC Secretary, CEO. Welcome, Madam CEO.
I know, sabi hiyo weights. Hiyo ni ngumu. Juu bado ukishika hivyo zinaenda. Labda kama kuna mtu kwa mic stand kenye atumii tuweke hapa. Ladies and gentlemen, I wish to announce the arrival of the chair to the parliamentary
The TSC directors, please respect the seat in front here. Finance director, please. Mr. Edwin, please come in front. The leader of
That we are asking this morning is to what extent, and all of you know that in the competency-based curriculum, we have what we call a key inquiry question. Can all of you say that? Because that is the key inquiry question we are asking today. To what extent are our key teachers prepared to ensure their learners and themselves adhere to COVID-19 mitigation measures during the school term? How prepared are they as they teach the classes that we have? As they handle the learners that have come from different places, even where they are affected by COVID-19? How much will they be able to pick up and make sure learning takes place, that no infections are going to continue in school, and the learners are wearing masks, there is social distance, and all the other measures that are required? These are things that we are looking at, and that's why we have that key inquiry question. And the methodology that we use, ladies and gentlemen, is use a cross-sectional study. This was a cross-sectional study across all the aspects of our teaching profession, primary, secondary, and teacher training. And basically, we did a questionnaire, an online questionnaire. This one was basically an online questionnaire where we sent an online questionnaire and we asked our teachers to be able to voluntarily log in and administer the questionnaire so that they can be able to tell us what is actually happening on the ground. And therefore, we just basically did an online survey, and we combined the data from both quantitative and qualitative, and we generated the statistics that I'll be presenting this morning, and the descriptions that we call the vignette. And therefore, these are the results that came out, ladies and gentlemen. And I'll be taking time to explain each of the areas, ladies and gentlemen, for the purpose of us really coming up and getting what is happening. The first thing I want to say, out of the online responses, we were able to get 5,176 teachers logging in and making sure they can answer the questionnaire. Let's give a clap to our teachers. I think that is a great honor that our teachers have. And we want to say, Mr. Indumuri and the capture chair, that we are very grateful that our teachers were able to generate such a number and participate in this online questionnaire that was there for the first time. And what happened is, if you look at the circle, the green represents the female. And the other, I don't know the other color. Is it the other green? The other right and green, eh? The other right and green, eh? It represents the males. And here we need to pose a number of questions and ask ourselves, when it comes to gender, when you look at the teaching profession now, we are almost 50-50. But from the observation, only 29.4% of the females are the ones that were able to join. 70.6 is the males. And we are asking a number of questions this morning. We did train all our teachers in the country using the remote learning methodologies. The female ladies were only 29.4%. The question we are asking all of us this morning, where are they? And every female that is here this morning, I want to put a challenge to all of you. Kewata is here, and we are happy this morning. The unions are here. Kesha is here. Kepsha is here. Where are our Lindy teachers? We want to challenge all of you this morning, both the male and the female. Can we encourage encouraged to make sure our teachers are in the front line, even when it comes to the issues of technology. Do all of us agree? Because we do not want to have such a small number of our Indians. And for sure, when it comes to the issues that we are talking about, they have been in the front line of some of these things that are happening. They are in the center of the family. They are the ones that are manning our children. They are the ones that are really looking at what is happening. So we want to challenge all of us, not only the ladies that are here this morning, but we want to really challenge all of us. Next time, when there is such an online representation on an online questionnaire that is brought on board, the gentlemen that log in encourage also the teachers, the female teachers also to log in. Are we in agreement today? Because we want to work together. We want to work together. That difference is very high. It's almost a difference of 50. 70 and 29. It's a difference of 50. So ladies and gentlemen, I am really pleading. Because we have trained a number of our teachers, actually almost all of them, on the remote learning methodologies, we are pleading that our female teachers also get a fair representation. Kewota, from today, you have something to do. Nat, you have something to do. Kepsha and Kesha, you have something to do. We really want to see this coming up. What was the range of the people that participated? We and the respondents that participated, the biggest number was the primary regular teachers. That was the biggest number, the primary regular teachers. And I'm so excited to say that now our teachers are ICT compliant. Because before we used to say primary school, many of them are not ICT compliant. But you can see this is not just a question of opening and closing a computer. This is a question of doing an online questionnaire. Meaning they opened, the link that was provided, they were able to log in, they even went to the internet and they were able to make sure that they can be able to answer the questionnaires. Director KICD, this shows happiness of our CBC, that digital literacy is peaking in the primary schools. Isn't it, ladies and gentlemen? And so this is something that we need to be encouraged about, that Kenyans, our teachers are now embracing use of ICT in the teaching and learning process. Then the other one was also the regular secondary. They also were about 30.1% of the 5,000 that we had. And you can see the secondary is also picking up. I think this is an answer to the remote learning methodologies that we have recently performed. And this is now an area that we really need to think about very pertinently as we join grade 7, which is coming soon. The other target that was very critical for us is the SME, the teachers that are in the special needs institutions. I want to say, ladies and gentlemen, irrespective of whichever situation they were in, they were able to log in and do the online questionnaire, which is very encouraging. And the Teacher Service Commission is very keen with working with the special needs institutions so that they are providing teachers, they are provided also the gadgets for technology, and they are not left out at any one point. And Teacher Service Commission is looking very keenly at the issues of special needs institution. We have begun working very closely with the Kenya Institute of Special Education, identifying the issues of the special needs, making sure the centers of special needs at the county level are well organized, and also building capacity of our curriculum support officers who are in charge of the special needs. And I want to say to all of us this morning, in any county that you are, we have curriculum support officers who are in charge of special needs. I wish that you can refer every case to them. they will be of great help so that every runner in the special needs area will be catered for. And moving forward, this is an issue that we are asking the county directors, we are asking the regional directors, both in the Ministry of Education and in the Teacher Service Commission. We take it very seriously so that our teachers in the special needs education are well catered for. Our children who are learning in the special needs institutions have the teachers, have the environment, have the infrastructure that is really key for learning. And therefore, the data showed that they also participated, and even the secondary SME, they also participated, and even in the primaries that are integrated, they also participated in answering the questionnaires. Where I want to challenge this morning is our teacher training colleges. We only had 2 responses. And I'm happy the officials of the Principals Association are here. This is a great challenge for us because we expected more of our lecturers participating in this online response, but there were only 2 of them. And so we want to plead that the officials that are here kindly begin to encourage the members and the tutors who are present to be able to do the best they can so that they can manage also to be part and parcel. So ladies and gentlemen, you can see we are the representative of all our organizations that we run as TSC, the schools that we run, the schools that we provide, the teachers, we and all this, and this was quite encouraging. Thank you. The other one is the locations. Where did we get all these people? We got them from the rural settings. We also got them from the semi-rural. We got them from the ASHA areas. We got them from urban. And we also got them from urban rural socioeconomic areas like Kibera and the other settlements that are there. And so you can see it was a big representation of our teachers from every location that they have. Let's move on. The next one is the level of the teacher preparedness, and I'll be dealing with this at each of them. We dealt with the awareness of the MOH guidelines. Are the teachers aware? Are the schools where they are teaching able to access clean water? Do they have regular use of sanitizer? Do they have the presence of psychosocial support services? And is there presence of guidance and counseling? So I want to go through all of them quickly this morning. The first one is MOH guidelines. And you can be able to see that our teachers, 99% are aware. They are aware about the issues of COVID-19. And the moderate extent is highest. So that we can be able to say almost all our respondents are aware of the MOH guidelines, which is a great plus for us as a commission and as a teaching fraternity. The next one is availability of clean running water. And note the word is clean running, not stagnant. Because COVID-19 doesn't want stagnant water. It is, we are saying clean running water. And you can see from the statistics, the possible causes of lack of adequate water, one is inadequate facilities. And we want to see this morning, the Ministry of Education has been on this issue of making sure that schools have enough water and even provision of tanks. You remember the time we were providing tanks, we were providing even desks, we were providing all these aspects. This is one of the things that the ministry has taken very seriously and has been the forefront, and we are happy about this. The issue of drought is making it very difficult for the question of having clean running water. The issue of long distances from the water source is also making it very challenging for us. The issue of having dry boreholes. You know, we have ran a spell in some of the areas in the country where we didn't have rain, and therefore the balls are dried, and then lack of adequate rain, which has been a challenge among other aspects that came out. Ladies and gentlemen, the next one is the issue of regular use of the sanitizer. And the one that why schools prefer not to use sanitizers, the one that came out very strongly is that they are costly. And the schools are not able to get the resources of making sure they can be able to buy. And then the schools also prefer use of water and soap. That is also the other preference why they are not using sanitizers. They are not also available in some localities. There are some localities where you go, you can't get a shop selling any sanitizer, and therefore they are not there. They are also considered as a health hazard, and therefore there is also the fear of learners abusing the sanitizer. You remember during the opening of the school term last term, our CS announced that we should not have them in the schools because of the question of the strikes and the question of banning of the schools that was there. So that was one of the aspects that came in, ladies and gentlemen, on the sanitizers. Then a number of things came up on the sanitizer on costs. And this is verbatim reporting, what the people say, that mostly sanitizer is too expensive to afford. We use it on staff and other visitors only. They are expensive and the school cannot manage buying them regularly. Use sanitizer is irregular and no sufficient funds to purchase enough for the staff. Purchase of the same is costly as the ministry has not allocated the funds. For sure, the allocation of funds are there, but remember after it was announced they should not be bought in school, that is what happened. And so they were reporting what is happening. There are unavailability, they are saying there is no unavailability of enough sanitizer. The sanitizer is not available, we run short of supplies. On the other hand, not affordable to all, dangerous to primary learners, especially the lower grade. They may taste or touch their eyes with it. That is why they don't want to use it. Others are saying it is expensive and may even risk the younger children instead of commonly using panda soap bar. And then there are allergies that may come with it. And then they are saying some learners may drink it. And then others are saying we use soap because sanitizers can be wrongly used by the learners. So those are some of the verbatim reporting that people brought on board about this. Then we looked at the best channel and the communication information and the communication materials for receiving messages for COVID-19. And the question we were answering is what is the best channel for receiving messages on COVID-19? Because knowledge is very important. So when you have knowledge of something, then you can be able to pick it up. And ladies and gentlemen, you can see one of the highest rated was the radio. And you can be able to attest this because we have the local radios that are really talking about COVID-19. We have the national radios that are talking about COVID-19. So many of the people have the radios and they are accessible. And then TSC bulk XMSs. TSC has been sending to every teacher through their payslip, through a bulk SMS, messages on COVID-19. And you can see it has reached that. And then the television automatically and all the way, the many aspects. And then we were asking ourselves also, what information, education materials will you best prefer to receive important health and education related messages? And we found that the best was the posters. And you ask yourself, why the posters? Whenever you go in this country, in any county, you will see posters on COVID-19. And we want to sincerely thank the Ministry of Health for that great activity they have really made to sensitize and to provide information through the posters. Let's give them a clap, ladies and gentlemen. Our people have been educated. even through brochures, and even through calendars, and many other aspects, even the social media. There has been a lot on the social media about COVID-19. Let's go next. The next one, we are talking about the medical services. And we were asking our teachers, in the midst of COVID-19, have you been able to access your medical services through TSC providers efficiently? Because TSC has provided our teachers with a medical service, and I'm happy Minette is here this morning because these are the ones that they manage. And our teachers were able to say yes was at 39%, yes was at 61%, and no was at 39%. Meaning our teachers have been able to access the medical services. And the kind of medical services they have been able to access is they have been having outpatient services has been the highest. The teachers that did the survey, about 62% were able to access these services, followed by routine check, and all the way you can see the services, the optical services, the dental, the laboratory services, the maternity, the surgery. So in other words, we are saying our teachers have been assisted medically. They have got assistance when themselves or their spouses are unwell, ladies and gentlemen. And then they are saying, why are they not accessing these medical services? What is the issue? Because some are saying, you have seen that 39 are saying they are not able. They have not accessed them. So we are asking ourselves why. And the highest was rated is a poor customer service. And I think this is one of the things that we as stakeholders, together with Minette, we can begin asking ourselves, what is the problem with the poor customer service? Where is this coming from? Is it the provider? Is it the hospital itself? Is it the way they are communicated? These are questions that we need to begin posing so that we can make sure this thing is sorted. Because when somebody has poor customer service, ladies and gentlemen, you know he cannot be served well. Even their attitude fails, even before they get the service. And this is why we really need to think about it very, very keenly. Then we have all the facilities and the low sum insured. Then the issue of lack of drugs in hospitals. This means it to be a serious issue, and the issue of the lack of medical officers. I think this is something that needs to be taken very seriously, because if a teacher goes to a service provider and he doesn't get the medical officer, then the teacher goes frustrated, and the teacher is supposed to be in class teaching, so this affects even the quality of learning, and this needs to really be addressed very fast. Then effective communication means for teachers, for TSC to the teachers. The highest is automatically the SMS and the bulky SMS that we usually send, followed by the posters that we usually provide, followed by the radio, the announcements that are provided, and social media and posters. These are some of the channels, ladies and gentlemen, as TSC we communicate to our teachers, and we are excited about it that our teachers are able to get different types of communication with different aspects on what exactly is happening to them. Next. Finally, we looked at the challenges the teachers might face as they begin this new term. And the highest one was automatically the COVID-19 management. And we are happy Willis is here. Dr. Willis is here, is going to be addressing this. This is our greatest challenge of our teachers. They are asking, yes, we are opening. COVID-19 is having a new wave. What do we do? So this is one of the greatest challenges. The other one is the syllabus coverage. Many of them were saying they might end up having the syllabus rushed because of the timing that is there. The time is short, and they require to cover a lot. So this is something that really in Dumuri, and the CASA chair needs to pick up, and the CAPTCHA chair needs to pick up very strongly to find a way of making sure there is quality learning, there is proper coverage, and all these things are going as required. Then the issue of congestion and overstretched infrastructure. We are saying, yes, we have more runners coming on board. How do we make sure the infrastructure that is already provided by the ministry is utilized well? What other methods are we going to utilize and make sure this is happening? The issue of increased workload is also coming on board, ladies and gentlemen. And the issue of increased workload is something that we need to take very seriously, because new classes are going to be put on board, and our teachers are going to be required to have more lessons to make sure they cover the learners that are there. The question of implementing the competency-based curriculum and the competency-based assessment, the CBC and the CBA in grade 1 to 5 is one of the challenges the teachers raised. The issue of no payment of school fees, now that we are starting the term on 26th, you have heard even parents in the news having a lot of issues. The issue of early pregnancies that will come up, and other things that also came up in the research that are the very low numbers, less than actually 1%, were the issue of drug and substance abuse. And only one response that came up, the issue of insecurity as runners walk to school also came up. The issue of disasters and truancy and the school dropouts. These are some of the things that came out as we were looking at this study. The conclusion is that the level of teachers' preparedness in the management of COVID-19 in preparation of term 1 2021 is fairly adequate and needs further strengthening. And this is all of us why we are here today to think about how do we do the strengthening. The recommendations that we have made, and the recommendations, ladies and gentlemen, that we have made this morning are recommendations for all of us as a team. How do we make it work? Actually, the issue is how do we make it work? Now that our teachers are starting school today, how do we make it work? And support them, all of us as a team and as stakeholders. Number one is that we need to increase the psychosocial support and strengthen the guidance and counseling department. Remember, our teachers are also psychologically challenged. Our teachers are not just coming to school when they are not affected. Some may be affected and others may have been infected. So the question we're asking ourselves is, are our teachers really able to cope with this? So we need to increase psychological and guidance and counseling, and all the stakeholders that are involved in this. We need to come up and see how we can support our teachers. Then we need to increase access to water and soap for sanitation and minimize the use of alcohol sanitizers. The ministry is very keen in making sure that water is provided in schools. Remember, they are providing tanks, and this is very encouraging. And we are saying, as stakeholders, as NGOs, as other members of the society and the community as large, how can we get in and increase the access of water and even minimize the use of alcohol sanitizers? Then sustain positive messages to teachers through use of bulk SMS. That one, the TSC is going to continue with it. We stick the posters in the classrooms, and we use radio for public awareness. All of you saw radio was the best and the highest rated way of the teachers receiving messages. Then we train teachers on management of COVID-19. The zonal committees that were formed through the Ministry of Health, and we are happy Dr. Willis is here, that they can be able to pick up more, get to the schools and work with our teachers, with the nurses, and with all the stakeholders that are available, so that they can be able to really enhance the training of the teachers in that area. Then we also enhance the contact with the health institutions and personnel in providing support and regular check, so that they can be going to school to check, work with the teachers, have a quick response mechanism that will really be able to really bring things on board. And finally, incorporate the use of remote learning methodologies, the ones that we have already trained the teachers, as alternative modes of curriculum delivery. And we are seeing this, ladies and gentlemen, in case things begin to get worse and some learners are told not to go to school, then learning should not stop. The teachers can be able to gather those learners wherever they are. They utilize the remote learning methodologies. They utilize the KICD ND channel and the radio channel and be able to learn so that we can be able to make sure we don't have a loss of learning time like we experienced in this year. I think now, ladies and gentlemen, COVID-19 came to make us wiser and think out of the box and make ourselves have things come to a reality. And I think that's the end, ladies and gentlemen. I want to really thank all of you for giving me time to share this. And thank you, see you.
Appreciate the good report given to us by Dr. Tamburi. Thank you, Dr. Tamburi, for the report that is well elaborated and which gives hope for all of us about the opening of school. At this junction, may recognize those who have arrived a few minutes ago as we started. We have Mr. Michael Njuri, representing the Interior Ministry, please. Please just start Bajene Makofi. Asante Sana. I have not captured another person that have arrived. Once we did the introduction, please. Any other person? Can I not have captured my list? Yes. That one I know. Thank you. Otherwise, at this point, let's go back to our program. And we have the keynote address that will be done by none other but the chair of COVID-19 vaccine development task force, Dr. Willie Arwani. First, my brother's knowledge, forgive me, my mother told me that, we are sorry for that. And he has been with us actually for many other days for this good work, and he talks very well and gives hope. Why don't you give him a clap as he comes in? Welcome, Dr. Arwani.
Somebody's phone here. Okay, good morning, ladies and gentlemen. First, apologies, I got delayed because when I was preparing to come, at the invitation of the CEO, I asked whether there are people who are not fully vaccinated because I wasn't sure I should enter the room. So I was told they are there. So I quickly said I will not live here when we have people not vaccinated. So later on, in an hour or two, we should ensure everybody who is settled here today is vaccinated. But let me start by asking a simple question. How many of us here are fully vaccinated? 2 doses. How many? Wonderful, wonderful. How many are partially vaccinated? These ones will be fully vaccinated today. So I know I've been asked, and my apologies, I don't have a presentation because I want this to be interactive. I will say quite a bit of Mark, but it is so important that we interact so that we come to understand where we are coming from and where we are going. We are fighting a disease known as SARS-CoV-2. What is SARS? S-A-R-S. You see that, isn't it? The disease is called COVID. It's called COVID, isn't it? Which is coronavirus disease. But when you go to get your results, they say, so why do they call it SARS? Then they write there CoV-2. Anybody? I said this is going to be interactive. One response and I'll proceed. Severe acute respiratory syndrome. Because there are other conditions that also cause severe acute respiratory syndrome, like the Middle East respiratory syndrome, which you've heard about. So, specifically COVID-19 is a virus identified in the year 2019, and it causes a severe acute respiratory syndrome. Now, when I walked in here, I've had a good presentation on its prevention. And I want us to just go, because before I talk about vaccine and we imagine the vaccine is a magic bullet, it is important to note that prevention remains the key. And prevention has many aspects, but simple procedures that really can help prevent the spread of disease. The very first one is what we call physical distancing or social distancing, as you say, 1.5 meters to 2 meters apart. This is something that was investigated by scientists, looking at how far droplets could move, and with that distance, then the chances of transmission are really, really minimal. So even as we go to open school, the issue, and I know it is going to be a challenge, but it is a practice that we need to make as long as feasibly it can. 1.5 meters, avoid very crowded places. That is another prevention measure. The use of masks, which I'm very happy is what we are practicing even in this conference, is indeed very, very important in reducing transmission. And you've actually seen, and again, studies showed that use of mask reduced the transmission within communities. The other one is hand hygiene, washing with water, soap and water. The virus, the outside part of the virus, which is lipid, if you use soap, it breaks that outside and therefore kills that virus. Use of soap and water generously, wash of about 20 seconds, not this one off. So again, when schools open, it's important to teach the students they really need to thoroughly wash their hands. Respiratory hygiene is the other very important thing we talk about. Don't go coughing, don't go spitting all over the place. Make sure you destroy everything that you've used upon coughing or spitting. Those simple measures, I can assure you, are very, very effective. And very important, avoid crowded places where you need to share air. They have been shown to increase infection. Now let's come to then the topic I am here to talk about in my capacity as the chairman of the COVID-19 Vaccines Deployment Task Force here in Kenya, which is mandated to first ensure there was introduction of the COVID-19 vaccines in Kenya, but they are quickly deployed so that Kenyans are protected and that our economy gets back to where it was, so that we don't have a lot of lockdowns. The rollout has very many aspects, starting from what we call regulation, registration of these vaccines, monitoring the adverse events of these vaccines, but more important is to get the vaccines into the arms of Kenyans so that they are fully vaccinated. So, the first thing I would want to say, and especially given that I'm talking to education stakeholders, I think vaccination among teachers has actually progressed well. It can be better, and the reason I think after today we need to really resolve that we can accelerate it. So the number of teachers we targeted to vaccinate during the first phase, which was March to June of this year, with the limited number of vaccines which were available globally, was 330,000 teachers. Those who have already received their first dose is 158,720, and those who have received 2 doses is 89,611. So we talk about second dose uptake. So out of the 158, those who have taken their second dose are 56%, which to me is not bad, because we expect to be at 60% now. This is not absolutely bad, but we want everybody who got the first dose to get their second dose, because we said that the first dose gives you a partial immunity. It gives you partial protection. It gives you something between 60 to 70% protection. But when you get the second dose, you get full protection. In clinical trials, up to 100% protection. But even now, as we see what is happening with more scaled up, the protection is above 92%. Now then the question is, so how many teachers are fully vaccinated? The data we have as of this morning is 27.1% of teachers are fully vaccinated. Now in this room, it was anything like 80. So we start seeing we still have a big gap to go, because we need all teachers fully vaccinated. We are starting at 27, and that we must do this quickly. There have been challenges with vaccines, but I can assure you from this week, next week, the country is going to receive adequate doses of AstraZeneca vaccines. We expect about 1 million doses of AstraZeneca vaccines coming in from European countries. We are going to get 1.76, almost 1.8 million doses of Pfizer from the US government. We are also going to start taking delivery of Johnson & Johnson vaccine, which have been bought by the government, 13 million doses. In another almost 3 weeks, getting 2 to 3 weeks from now. So vaccines are now going to be available. So the challenge we'll have is to get people vaccinated. So, but the question has been, and I want to address some, why are some people still hesitant to be vaccinated? Why are some people hesitant? Even now, when we are watching news and we see that in America, where there is now an increased number of cases, the people being admitted, almost 90%, are the unvaccinated. The people who are not vaccinated are the ones coming down with the disease. So I would want to try and answer some of questions that have been asked, including, because I have very many friends who are teachers, what they have been telling me. And I'll start with one before I go to the common ones. There is a teacher who told me, how come there was a big outbreak in India, we were shown people dying and being burned, and then you people immediately brought the vaccines. Was it to scare us to be vaccinated? And I said, no, this is the challenge with this disease. We never know when there will be a surge. We never know when another variant will come. It can strike any time. So the best protection, even as we think about fourth wave, fifth wave, whichever wave, is to be fully vaccinated. Now, let me respond to a few questions. People ask, weren't these vaccines rushed? Why did they appear so fast? You have not got a vaccine for HIV, you've not got one on malaria, you've got one on TB. And the answer to that is this. The scientists had been working to improve vaccine platforms, which is basically the base in which you produce the vaccines. And a lot of work was done to do with Ebola. Remember, Ebola kills much more. What you call the case fatality rate of Ebola is about 20%. Meaning, out of 100 people when they contract Ebola, 20 will die. You keep hearing now our fatality rate for corona is about 2%, isn't it? Out of 100 people, 2 will die. So Ebola is a much serious disease. So a lot of work had gone there. Now, based on the platforms that were being developed, the scientists easily worked on that to produce the vaccines. Now, vaccines, you first try them on what you call animal models, then which is clinical phase 1, then you go to phase 2, where you start administering them to humans. Then phase 3, you increase the number of human beings and you monitor side events, any side effects that are there. So the current vaccines that we are using, based on the results of phase 3 trials, were found to be safe and effective. And they were therefore issued with what you call emergency use authorization. The reason that was done is this. They were found that if they were used in individuals before they got corona, even if they they prevented severe disease. Chances of going to hospital to start being put on oxygen, being in ICU, being hospitalized is minimized. And also importantly, they prevent death. So given that very good utility of it, they were given that emergency use, they need to be used to save lives. But as you do that, continue monitoring any rare side events that may be coming. That's what is required. Monitor the people who are given proactively. So that is really what happens, so that we started using these vaccines. Now, the issue of clots, and it was a lot talked about in March, April, immediately we rolled out. And what is required is that when you are in emergency use, even if a simple side effect occurs, you are supposed to report it. You can stop giving the vaccines, and what you are supposed to see is if there is a direct link to that side effect. Now, two things to remember. Even coronavirus disease itself causes clots. Other conditions can also cause clots. So the issue is, if any clot occurs, is it directly linked? Now, what has been found is that the occurrence is so low, the ones which is directly linked, 1 per 1 million or so. So the benefit of the vaccine far outweighs the risk of death from the disease. There were concerns about infertility, long issues that has been used, misinformation that has been used by people against vaccination. For many years, people who are against vaccination did not just come with COVID. Some have been there. Now, with COVID-19, a number of studies have been done, and it has been shown it has no impact on the sperm count following vaccination. The issue about altered periods, it could occur in a few people, but it is just related to a bit of the hormones that may be used, but it does not cause infertility. And within time, regular menses come again. Then finally, let me talk about the recent one about a disease, an autoimmune disease where the body starts fighting itself, Guillain-Barré syndrome. This is again a disease that can commonly occur, especially following certain febrile illnesses, which could even be a common cold. It could occur spontaneously, and you get weaknesses. It resolves, although in some cases it could become severe. So again, what the Americans have found, this is rare, but it's important to note that even other vaccines are not only Johnson & Johnson, including those that are used to vaccinate against flu, can also cause Guillain-Barré syndrome. Now, having said that and having had a lot of misinformation, initially I heard that you are vaccinated, your hand becomes magnetic, you pass near sparks, metals will fall on you. There is a lot of misinformation, and a lot of this is in the social media. And for us in the task force, initially we were saying, how do we counter this? Is by consistently giving right information. Because on social media nowadays, people can actually talk like they really have all the information. Yet what they are giving is misinformation. Now let me come to our plan, the so-called deployment plan. So we had a plan that was from this year 2021 to 2023. However, after consultations with government departments, we have now merged so that we have two phases. The first phase ended on June 30th. Now phase 2 and phase 3 have been merged, so that now from this month of July where we are up to December, as you heard His Excellency the President has directed that 10 million Kenyans should be vaccinated. And by next year, all adult Kenyans, estimated at 26 million, should be vaccinated. I must say that the first phase, unfortunately, we had the global shortage of vaccines brought about by many issues, because the rich countries were holding on to them. And holding on to them, when we talk about stockpiling, the issue is this: they had booked production. It's not that they had produced vaccines and stored them there, because I hear some people saying now the ones which had been stored in the mnapewa zile zinaisha haraka. A lot of it was production they had booked. So even if you had money, the production lines were fully booked by the rich countries. Now they have vaccinated their people, they are releasing them, and they are sharing with the developing countries. And that's where we are benefiting. But also now, countries, including Kenya now, with our own money, we are able to place orders and will start receiving vaccines next month. So it is doable that we can vaccinate 10 million Kenyans by end of this year. But our strategies will change. And I stand here confident now, it will not be where are vaccines, ziko wapi niende. It will be you making that very important decision to get vaccinated. So what are some of our strategies that we are going to deploy? So you realize we are now for the first time going to have more than one vaccine. So we will have AstraZeneca, Johnson & Johnson, Pfizer. All these vaccines are good. All of them will protect you from the primary aim of severe disease and death. Don't go to sterile debates about which is better than the other. In fact, what my task force has said, we are just going to identify facilities. We put Johnson here in Kenyatta, for example. I'm not saying that's what we'll do. Mama Lucy, we put Pfizer, and maybe KU, we put AstraZeneca. When you go there, the vaccine which is there is what will be administered to you. And I want to give Kenyans the assurance all these vaccines will protect you. That is the first point I want to make. And therefore, it brings into question how effective. Our plan is that there is the Chanjo Kenya system, which now has what we call a self-registration module. So through your mobile phone, you can log in and book the date, time. The date actually. Initially we'll start with the date. When you want to get vaccinated and which facility you want to go to. And this should start maybe in 2 weeks. As the now vaccines start coming, we want self-registration. That's number one. Number two, some of these vaccines require a lot of logistical arrangement. For example, Pfizer must be quickly used. So if a vaccination post does not register enough people, it becomes a challenge for us to send, for example, Pfizer that has to be used within a period of time so that we don't have any wastages. So we will be monitoring which facilities, where do we have enough people registered to be able to deploy certain types of the vaccines. The other strategy will be use of outreaches. We have not done this at the moment. We've done a little bit of it, but we want to scale it up. And one of the recommendations of the task force is that outreaches to reach teachers is going to be a key priority. We are going to work with the Ministry of Education, the
Thank you, Dr. Willis. It was very kind of you to come, and that was a great speech. The Chair, Teacher Service Commission, the Chair Education Committee, Honorable Motua, the representative of our PS, Bwana Kibet, the Director, KICD, senior officers from the Ministry of Education and TSC, our esteemed stakeholders, distinguished ladies and gentlemen, welcome once again. And before I make my very few remarks so that when we can go to the plenary, allow me to humbly invite Mr. Kibet to say a few words on behalf of the PSCs. Kindly.
The Chair of the Commission, Chair Education Committee, the CEO, invited guests, ladies and gentlemen, good morning. I bring the regards from the Principal Secretary who was unable to come because of other engagements, and the message is to our teachers, we appreciate the work that you are doing. To the head teachers and principals, we appreciate the good work that you are doing in management of resources. As we open schools today and as we welcome Form 1s next week, we look forward to a full house. I know this is the first time in almost or more than a year that we are having all our students back to school, and let's manage all the challenges that come the way we did during the partial reopening. Thank you so much, and God bless you.
Before we also proceed, let me request the Chair, Education Committee, to come and make a few remarks.
Since I'm partially vaccinated, let me not remove my mask. Dr. Nancy Macharia, Commission Secretary, CEO, TSC. Dr. Jamlek Muturi, John, Commission Chair. Commission Chairman, Professor Charles Ogondo, Director, KICD. All the TSC Commissioners, Director Kibet from the Ministry of Education, and all the TSC Directors, union officials, KEPSHA, KESHA, all donors, and all invited guests. I think it's still good morning. I want to thank Nancy Macharia for the invite, and I have a very, very brief speech. on this very important day. Dr. Will, is this mask, sir? Thank you very much. Owing to the prolonged closure of learning institutions in the year 2020, teaching and learning activities in all learning institutions in Kenya, just like other parts of the world, have severely been disrupted. The worst hit learners are the primary and secondary school candidates who had to readjust to the new and short calendar years between 2021 to 2023, when normalcy is expected to resume. We recognize that disruptions as a result of the pandemic have impacted student learning and also the well-being, more so even emotionally. We also acknowledge that the uncertainty of the public health landscape will present ongoing challenges for the education sector in the new school calendar year that starts today in the month of July, a departure from the past. In the effort to adjust to the new norm presented by the pandemic, there is need for the Ministry of Education, the Teacher Service Commission, parents together with all stakeholders in the education sector to come together and build a synergy to navigate through challenges to ensure continued access to provision of quality, equitable and inclusive education during and after the pandemic. Effective implementation of the proposed interventions by the teachers and stakeholders as outlined in the report on teachers' preparedness for commencement of the new school year by the Commission, which has been launched today, will ensure uninterrupted learning in educational institutions, safety of learners, teachers, and school staff. In the year ahead, it is important that as school managers, teachers, and parents, we remain committed to the health, well-being, and safety of students and demonstrate renewed focus, recovery of the lost learning time as a result of the school's closure. As the Committee of Education and Research of the National Assembly that oversight the education sector in the country, we will continue to harness available resources, appropriate funds for schools' infrastructure and recruitment of teachers, formulate policies and mobilize stakeholders to ensure that every Kenyan child enjoys right to free and compulsory basic education as stipulated in the Constitution. The committee will also continue to strongly support the Teacher Service Commission to perform its constitutional mandate and develop a competent, respected, and contented teaching force. I must also applaud the ministry, and the Director Kibet is here, for ensuring that we have adequate infrastructure, even as we continue to ensure that this is fully achieved, because it is continuous. I also applaud the presenter, and especially on the survey, it has actually captured the right challenges that we are going to expect, and we must tackle them together moving forward. I'm happy Dr. Willis has talked about ensuring the teachers are fully vaccinated so that they are safe as they teach our children. Finally, I don't want to wade into the issue of the light green and the dark green. As Dr. Damburi said, Kewata is here, and I'm happy we will be up to the challenge. Tutakutana nyuma ya tent, we discuss that issue after the meeting, because I'm sure our teacher ladies out there are fully up to the task. Even on a lighter note, there has this been issue of the boy child saying that they are already in danger. So let us not be challenged so much, because we might actually put the boy child in danger. However, we want to move together as a country. Thank you very much, Madam Nancy, for the invite, and thank you so much for all the education people out there, the entire education sector, for the good job that you are doing. Asanteni sana.
I thought I was told, but and I'm happy we have a doctor in the house, because I'm doing a balancing act with so Dr. Ngondo, now you see what you have to do, because They are telling me they couldn't even get Mheshimiwa. I was telling them Mheshimiwa is even shorter than I am. Okay, thank you, Honorable Mutua. And let me just read my short remarks so that we can move on. And I want first to start by thanking all of you for finding time to honor our invitation and to attend this forum, either physically and even those online on this first day of the 2021 school academic year. This forum, the first of its kind, is a manifestation of the fact that TSC is determined to step up its engagement activities with all the stakeholders as a move to ensure all of us are fully involved in improving the welfare of the Kenyan teacher, who is the nerve center of curriculum delivery in our schools. We must particularly thank all our teachers for risking their lives in the height of the COVID period to return to school in October 2020 and later in January 2021 to resume teaching after the reopening of schools after the closure occasioned by the pandemic. Please let us once again appreciate our teachers through a round of applause, please. Yes, because they have braved this pandemic and gone back to school and taught our children. The gesture is clear proof that the government's decision to allow us to pay our teachers 100% monthly salary throughout the period when the schools remained closed was worthwhile. And we thank the government for paying our teachers even when they remained at home during this pandemic. Further, we thank His Excellency, President Uhuru Kenyatta, for allowing the Ministry of Health to open the vaccination exercise to all teachers, irrespective of their age, soon after the government categorized teachers as part of the frontline workers. And Dr. Willis, we are very thankful to you and the Ministry of Health for everything you have done to us and our teachers, and even for honoring to come here today. I want to belabor on the numbers of the teachers that have been vaccinated, because Daktari has said that 55.6% got the first dose of vaccination. And mine is to rally all those teachers who have not gotten the first, even the first dose, to go and get it now that you have heard the government is bringing enough doses in the country. I also urge the 44.4% of teachers, the 44.4% I think are those teachers who have not received any vaccination at all, to quickly go and get the jab, especially now that the school term has started and all the children are back in school. Please, dear teachers, go and take that jab. Fellow teachers, let us take the ongoing immunization exercise seriously, as COVID-19 is not sparing anyone. For instance, we have so far lost 73 teachers to the virus since it was first reported in the country. And thanks to our full medical insurance cover, 454 teachers have fully recovered from the virus. As schools reopen for the new academic year, I urge all teachers to fully comply with the COVID-19 measures as part of our preparedness to dispense our duties effectively and protect the children. As you can see from the survey, whose findings have just been presented here, teachers are fully prepared to attend to our learners despite the existing challenges. We are aware that with the return of the 15 million learners and the classrooms, to all the classrooms, resources will be more constrained. Yet, as teachers, we must adopt more innovative measures to ensure learners get quality teaching. We also understand that we continue encountering a few challenges in providing our teachers with all the necessary protection against COVID-19. Yet, we must strive to wear masks and wash our hands regularly with soap and running water, or use sanitizers at all means. Actually, I have just removed my mask because I saw Daktari remove his. I never remove my mask, and then when we were talking in the morning, he told me that when you are fully vaccinated, you are much more better, and that is the strength I got. We must not drop the guard on adhering to the MOH measures. I have asked our medical health insurer, who is here today and is also participating online, to ensure that all facilities that attend to our teachers should and must provide fast and quality services to our teachers and their dependents. This is because, and I know Minette is present today. Remember, teachers are attending to these students. Remember, teachers are also parents. They go home and find their children back at home. Teachers must be taken care of. And so our medical provider, teachers must be taken care of in those facilities wherever they go and their dependents, and as fast as possible so that they can then go back to school to teach our children. Findings from our study should point the provider to where they need to do better. And I think then you shall be meeting with the commission so that we can discuss more on these findings. On our part as TSC, we have ensured teachers remain stable at their workplaces by putting on hold annual transfers, and only those transfers that are forced on us by natural attrition or other factors will be affected. I urge all TSC field officers to work with the school principals and with the Ministry of Education staff to ensure all learners selected to Form 1 are admitted to realize the 100% transition from primary to secondary education. Further, I want to direct that all heads of school stick to the stipulated school fees. Mr. Idimuli, please, you will help us here, and Nzioka, where there are levies. The TSC is investigating a few allegations that have been handed over to us by the Ministry of Education that some teachers are not complying with government directive on fees. Action will be taken on those few if they are found culpable. Starting 1st August, the TSC will be posting 8,914 teachers to schools as part of its determination to ease the curriculum delivery burden on teachers. I urge school administrators to quickly settle down the new staff and ensure they attend to learners in the academic year that is heavily constricted to recover the time lost last year. I'm also proud to announce that the TSC has trained more than 90,000 teachers in readiness for the rollout of the CBC in grade 5 this term. In addition, I wish to inform the country that the National Treasury has allocated 1 billion shillings for further CBC training to ensure a smooth implementation of the curriculum. And to increase efficiency in our teacher management activities, the TSC has digitized all its records to enable staff to access all their services at the touch of our button. I know sometimes we experience our challenges, but we are doing this to ensure that our teachers are taken care of and that they can remain in school and still communicate with the employer. This will be enhanced by the ongoing biometric enrollment and validation of teachers, which is commonly known as BVOT, that is currently underway. I also wish to register my appreciation for the support we get from our development partners who have been extending, who have been working with the TSC in provision of quality teaching and in the fight against COVID-19. The Commission is exploring areas of collaboration with the development partners, and we welcome you to continue engaging us in any area of common interests. As I end my remarks, and with the permission of Dr. Willis, I am told he has come with his personnel, and as we leave, you'll be seeing them out there, so that those of us who have not been fully vaccinated get fully vaccinated by the time we leave KICD. We had also asked our Kesha and Kepsha and our partners to also come with other people, with the teachers who would want to be vaccinated. So as we go out, please ensure you take that jab if you have not taken it. I therefore finally wish to thank all our stakeholders here today and also ask them to take advantage of the research findings released today to support the Kenyan teachers and indeed the TSC at every possible level to deliver on their mandate. I also wish all learners a smooth 2021 academic calendar year together with your teachers. Thank you very much indeed for listening to me. And at this juncture, I wish to invite the Commission Chair to just make a few remarks before we continue. Thank you very much.
I'm shorter.
Thank you, the Chair of the Education Parliament, Honorable Mutua, our hosts, Professor, ladies and gentlemen, good afternoon. Afternoon, is it afternoon? Oh, good morning. How are you? Let me thank all of you for finding time to come to engage with us. We are really very, very humbled as TSC, and we want to appreciate the fact that you have come here so that we can engage, we can share on the findings that we have got. Scientists will say data does not lie, and that's why we said we need to get the real data from the field to really know how well prepared we are as a commission and the teachers in the delivery of our mandate. Madam Chair, I want to thank you from the Parliament and all the other elected leaders in the Senate, and more so His Excellency President, for the support that you have given all the teachers and the commission in us to execute our mandate. Your support is appreciated. I wish to take this opportunity, therefore, to welcome all of you to this forum, and I want to echo the words of the CEO, the first of his kind, and assure you that the Commission greatly appreciates your presence and participation. I believe together we will win this battle and be able to deliver our mandate as a Commission. As you are aware, and it has lately been put across, the TSC Commission, we are only 4 members now, and I request my colleagues to stand again because of the new members who came in. Commissioner Ucho is at the corner there, is one of the commissioners. Commissioner Mbage, Commissioner Leila, and me. We are supposed to be 9, but we are 5. We are 4. Others are on the way coming. And we are delivering our mandate as per the Constitution. This is therefore a very great opportunity for us, because even when we are shown in this pandemic, we have been able to deliver. And I want to thank the Secretariat, who we have worked very closely together, because you can see as we talk now, we have virtual attendance and we have physical attendance. This is still in adherence to the protocols that have been given by the Ministry of Health, so that at least we reduce the spread. Therefore, as a commission, we have such a great opportunity to meet with you, the key stakeholders, and listen to your views on our findings. We would like to engage very objectively, because this particular work has given us the level of preparedness for full reopening of schools that kicks off today. This forum, therefore, is very timely, in that the Commission recently also visited the stakeholders out there. We were in Kitui, the four of us. We were in a part of Embu Meru, we were in part of Nyeri, and we're also going out to the Western Bloc to find out exactly what's happening to our teachers on the ground. And this particular engagement with the stakeholders enabled us to realize quite a lot what's happening out there. And I thank the Commission Secretary, CEO, because he instituted a very urgent and fast-tracked the process of this particular research. Allow me to say that since the outbreak of the COVID-19, it has already been put across by the CEO, we have lost a number of our teachers and even our parents. Allow me at this juncture, with all due respect, we observe a minute of silence in honor of our great teachers. You can stand, please. Our Father, may you bless the families of the teachers we have lost. Give peace to them and the schools and institutions they have been working in. In Jesus' name we pray. Amen. Thank you. Madam CEO has rightly put across, they are great heroes. Even when things were not stable, as frontline soldiers, they were there in the field working and sacrificed their life. We applaud them, we appreciate them. It is when people are confronted with this kind of a reality that the Commission undertook this empirical data on teacher preparedness as a full reception and assumption of school reopening takes place from today. I am happy to know that the evidence presented here today point to the fact that teachers are ready for full reopening. It has rightly been put across by Dr. Daburi, and we have seen that, and the Minister of Health should know that, the teachers are very aware of actually all the procedures, the way you have explained them here. And all of us know the teachers play a very key role. When Dr. was speaking here and Dr. Willis and explaining to us, if it was in a school parade, either at the ECD level, at the secondary school level, and then the teacher comes to explain, the students will be more attentive to the teachers. And therefore teachers are very good conduits to reaching the lowest possible level. I wish to appreciate all the heads of the institutions, the board of management and the teachers for being resilient during this most challenging period. Teachers play a fundamental role in educating the communities. Hence, being far-flung soldiers, their positive message will reassure the pupils, students and parents on the continuity of learning in our schools. As a commission, knowing that COVID-19 pandemic is still with us, we would wish our teachers and institutional administrations to adhere and do the following. One, let them ensure that the public has trust in what the government is doing, and also ensure that all the protocols given through the Ministry of Health are followed as stipulated. Two, they need to ensure that the resources given either by the parents, by the stakeholders, by development partners, and even by the government are properly utilized in fight against COVID-19. Let them also ensure that the learners and also other people working in school, because for example in all schools we have the support staff. Let them ensure that everybody within the school environment is following up the procedures and the protocols given, and that everybody is aware and they speak it day in, day out at all forums. Even when they are teaching various subjects, maybe mathematics, they can use the data to drive issues in that perspective. Then they should ensure that our learners observe the necessary procedures and ensure also that the environment that the learning is taking place is conducive and that it doesn't entertain the spread of the COVID. I agree, the number of students that are now coming will be more because of Form 1s and also grade 5. But within the framework of the environment they are in, the teachers, I know they are well prepared and they ensure that learning is taking place as well as people or the students are safe.
Allow me also to say, in conclusion, ladies and gentlemen, that the teaching profession, therefore, calls for all of us to sacrifice, to enable learners to achieve their goals. Madam CEO has rightly put across, the term are going to be very short. And therefore, the teachers have to go an extra mile to ensure that the students or the learners get full knowledge that is required for them to do the exams and pass well. So we are calling upon the teachers, as they go an extra mile, then let all stakeholders support the teachers at the very station the teachers are working in. We are calling upon the entire system, starting definitely with the parents, who are the immediate beneficiaries. We are also calling upon the political class at the lowest level, the ward level, the constituency level, and at all the levels. We support the teachers so that at least they can deliver within the framework of the existing condition. In conclusion, ladies and gentlemen, allow me to appeal to all of you, even the development partners, come in and support also the Ministry of Health to ensure that we get all the necessary requirements so that we can succeed in this battle. Allow me to reassure, therefore, the Ministry of Health that with the teachers we will not go wrong, because the teachers are real the light of the society. With those remarks, let me thank you and appreciate your coming, and therefore allow me to request that we engage and interrogate our discussion so that we can develop the way forward as the school opens today and progresses within the year. Thank you and God bless you.
Now it is the plenary, and I request the CEO that we can do. This plenary, and we have now our stakeholders time to react on to all what has been said, particularly the report that came up after the survey on the teacher preparedness. I will make it easier so that we can move. We can have about 2 minutes, so that we will also time factor to contribute, depending on how you feel about the issues. Let's start with the question, please. Question, please.
Thank you very much, Master of Ceremony, the Commission Chair, Dr. Jamlek, the Commission CEO, Dr. Nancy Macharia, the Chair of the Education Committee in Parliament, our seniors who are here, ladies and gentlemen, good morning. First, I want to begin by appreciating, this invitation and the research carried out by Teacher Service Commission, and mention that the points that have been raised actually resonate well with what we are going through in our schools. On behalf of the heads of this nation, I want to mention that some of the areas that have been noted have been our concern. We've raised some of them before, and I'm happy that this research has exposed them. And it is important as a nation that the findings of this research are taken very seriously. And I stand on this platform, I want to appeal to all Kenyans that schools need more than just talk, but we need support in mitigating some of these measures. We are well aware that, yes, social distancing is going to be a problem. And this we cannot cheat ourselves. And if we have to maintain that social distance as it has been stipulated by the Ministry of Education, then a lot of funding will be required. This I want to call upon other stakeholders, not only the Ministry of Education. We want to call upon the county governments so that they don't keep saying that education is present, so that we can tell you what teachers out there go through in the hands of Minet. I want to appreciate Teacher Service Commission for the digital learning technology that has been going on. Principals have been trained and teachers have been trained, and the training is still going on. And that is why you saw the uptick. I want to assure you, as Kenya Secondary School Heads Association, we will do our best to ensure that all teachers, without looking at the agenda, really participate on issues of online teaching. Vaccination. Let me use this platform to appeal to all our teachers to accept to be vaccinated. I resonate very well with the words of Daktari, where some teachers had talked to him. I think it is very true. And sometimes we are told, which vaccine is this? That even after vaccinated, I still have to continue wearing the mask. So these myths must be removed. And I want to ask teachers, we play a very important role. Let us lead by example. Personally, I was among the first to get the first vaccine, and I've gotten the second, and I've been encouraging teachers on my staff to do the same, and I'm happy many are doing it, although we still have a few. I want to call upon my colleagues to encourage all teachers to be able to go for vaccination. Challenges of financing of schools. As we prepare to reopen, this is an area that is still very fluid, still not very understood. We are aware that the Ministry of Education has given out capitation, and it has stated that more capitation is coming. But we are not clear here, and I'm sure Director will be able to make it more clear, whether the capitation that the Minister has talked about is what was released just before we closed, or we are expecting capitation as Form 1s come in. This is still not very clear. The issue of fees payment, the research has shown very clearly that fees payment is a challenge. And here, the chairman of parents is here. And I want to tell this nation that principals and parents are not at war. Chair, Parents Association, principals and teachers by extension are your members. Because we too have children. So we cannot want to punish ourselves. Where we have colleagues who may have gone overboard, let it be dealt at individual level. But it should not be a condemnation of the entire principals and head teachers fraternity as wanting to really punish the parents of this nation. We are parents. But fees must be paid. This one, we should not pretend. Because you send children in schools. These children must be fended for. Those in boarding schools, we must feed them. Yes, and with this one we totally agree, the schools, the parents needed to be cushioned. The question is, who cushions the school? Yes, we will reduce fees, and we are going to do it, and it has been done. But we want an assurance that the arrears that parents carried at the end of last year will be paid. And I think the chair is here today to assure this nation that parents will pay, so that schools are able to mitigate the challenges that have been posted here, so that we can fight this disease together. In conclusion, I want to appreciate the efforts the Teacher Service Commission has put in place to ensure that we have enough teaching force. I'm aware that beginning from today, we have interviews going on in various centers. Our school, for example, we are participating today, and my deputy is in charge. So we want to appreciate this, but still ask government, I know we keep asking government through the Education Committee to see how to allocate more funds in order to recruit more teachers, so that that workload that Dr. Damburi did present, the increased workload is also because of the shortage of staff. So if we can get more staff, then the workload can be reduced. Otherwise, ladies and gentlemen, we want to applaud the research team for what they have done. We wish that these findings are going to be on the TSC website, so that we can download and interact with them more. I'm sure I have my colleagues here, just maybe they had not been seen properly. Today I have our National Secretary, Mr. Kuria, Chief Principal, Muranga High School, and I have the Chairman, Nairobi County, Mr. Kimei, Chief Principal, Lenana School. Thank you very much, and may God bless you.
Makofi. Asante sana mwalimu mkuu wa shule ya upili ya Machakos, na pia mwalimu in charge of education, ambaye ni ashughulikia maslahi ya walimu, principals wa shule. Tamuomba interact a bit and move a bit, so that we move our program. The next presenter, let's have Coopet, Associate Union, please. Coopet.
Thank you very much, MC, the CEO, Teacher Service Commission, the Chair, the Directors, both the Ministry, Teacher Service Commission, invited guests, ladies and gentlemen. Good afternoon. Good afternoon. My name is Moses Ndorima. I am the Deputy Secretary General representing the Secretary General, Akelo Misori, who took his, one of the family members to the hospital, supposed to be here. I want to take this opportunity to thank the Commission for these findings. The new commission, the Constitutional Commission, I want to appreciate the reforms that we are seeing being spearheaded by you, and particularly when issues of teachers are based, the services are based on research. Truly, this is what we have been lacking in the previous dispensations of the Commission. We have seen a lot of reforms, and we want to appreciate this. I want to say that this research has come at the right time, and from the early speakers, I want to echo what Akalwale has said, that Daktari, that they are going to use schools to disseminate the information about the vaccinations. You know, teachers and learners are vehicles of communication, and very effective for that matter. How I wish that some of the resources that are being used at the ministry could be cascaded down to the teachers so that they do this one as quickly as possible, because I know they have the muscle to bring everybody else for vaccinations. The other issue that has been brought out by the Commission, and the National Chair of Kesha has brought it out, is about minutes. Treatment is both psychological and medical. When teachers go to facilities and they are mistreated, they get even more sick. Can you treat teachers with human face? Because there has been a lot of complaints. Teachers are paying a lot of money to you, and whenever they go for services and they find there are no personnel, there is no medicine, they are being kept there waiting. Others are treated and teachers wait for a call from the provider. And these are, you know, the torch bearers of the communities. People wonder, what are these people doing in the hospital? So can you stop frustrating teachers? Because complaints are all over about the way teachers are being treated. Many of us are under medical covers, and whenever they go to the hospitals, they are never treated the way we need to treat teachers. 9 billion is no little money that the underwriter received from the teachers. So because of the situation we are in, we want to prevail upon the medical provider to change the way they are treating teachers. Because as unions, we shall not continue sitting down and waiting to see what you are doing to the teachers. In fact, the next battle now is going to the underwriter. I know you are in business, but when we start asking teachers now to do strange things against you, you will not like it. Otherwise, those are the comments I wanted to make. And thank you very much, the Commission.
Let's now open the floor. I will see the hand of the AEP on the app, so that we have to be more men, go to move around the city, and then you have the team at the front of the app.
Thank you, the Commission Chairman and the Commission Executive Officer, all protocols observed, stakeholders, ladies and gentlemen, good morning. My name is Hesbon Otieno. I am the Deputy Secretary General, Kenya National Union of Teachers. I'm standing in for the Secretary General who was in here, but he has briefly left. Together with me, I have the National Chairman, Brother Patrick Karinga. I have the National Treasurer, Hussein Ali Abdi, and also our Chief Officer, John Gitari. Yeah, I want to also thank the Teacher Service Commission for organizing this kind of a forum. It is one in a million. More so when we are opening the schools and with this situation of COVID pandemic. Many people would not care how schools are being opened, but we have seen that the Commission has taken time to carry out a good research that has given us an eye-opener that even as we are opening schools, what kind of situations we are going to meet, also considering the recommendations that we have had. Hard hit is the medical provider, because facts never lie. At 60% poor customer service, it is an issue that a very strong conversation should be put in place between the service providers, the Teacher Service Commission, and the stakeholders, so that our teachers do not cry. They get this service. More so, in some of the facilities we're being told that they do not even, they say they do not take care of COVID patients. So we really want to go deep down and find out if this is really working. I know our friends from Mineta are here. We want you to take this. It is very positively, but also very strongly as a concern of the stakeholders. Two, in the recommendations that were given to us, my friend Dr. Ntamburi, I did not see anything that led us into inquiry why teachers are not coming out to be vaccinated. Because from the data that we are getting, out of the 330,000 teachers targeted, only 89,000 have been fully vaccinated. That is a very, very minor figure, considering that we were given the first priority. So we want to demystify the myth why teachers are not really coming out, despite the campaigns that have been done for them to be vaccinated, considering the environment they are working on. So Dr. Ndamburi, I expected to see something on that area. I want to concur with my brother, Chairman Kesha, and together with the Kupet, that there are very many other areas that need to be looked into that will ensure that our schools are safe. When we talk about social distancing, I want to assure Dr. Halwale, is it not Halwale? It is. Yes. I want to tell you that.
Let me say Dr. Willis.
Dr. Willis, yes. I want to tell you that social distancing in schools, we will not pretend it is not there, and it will not be there as far as the conditions remain static as they are. So it is only that by the grace of God and with the students having their masks on and the constant taking care of the other mitigating factors, they are surviving. But the issue of social distancing is a very difficult one. So finally, as Kenya National Union of Teachers, we're back to the fold, and we want to thank the CEO and the TSC that we will work very closely to ensure that all issues pertaining to our school environment being very safe will be taken care of. We want to fully participate. We want to disseminate conversation with our teachers to ensure that they follow and they abide by what will make the school environment safe, but with the support of the Minister of Education, Dr. Kibet is here, that the environment is conducive for our students to learn. So thank you, and may God bless you.
Secretary, Deputy, for that, those good remarks. I have only 3 people that will speak, so you can move. I have the sponsors, representative, Muslim, talk, then I move to water, and then the application and the Parents Association, and we leave at that point so that the others can have the discussion. Okay, the name, please. Thank you.
The chair of TSC, the CEO, the director KICD, director quality TSC Dr. Ruben, Dr. Willis, Akhwale, all the protocols observed. When you get chance to speak after several have spoken, nothing is left for you. So mine is to just support what is being done. This is a unique gathering. We appreciate the efforts of the TSC. I am representing Muslim Education Council. Muslim Education Council is a recognized body in the Education Act, and we are represented in all the county education boards in the country. All my representatives in the counties are sending me messages of appreciation for what TSC has done. We are always in support of the government and the ministry for the betterment of education and welfare of the Kenyans. I would just say that whenever you involve the stakeholders, you will never go wrong. But you make the decision without considering the opinions of stakeholders, you will always have conflicts. So my advice to you is to make sure that before making any decision, especially in the education sector, involve all the stakeholders. We are always ready and available. Dr. Willis, we as a school and Muslim Education Council have done a lot. I represent Muslim school, one of the oldest schools in this country, on Park Road. All my teachers, 100% have been vaccinated fully. And we organized vaccination sessions last 2 months in several Muslim clubs where I am a member, and more than 10,000 people have benefited from that. So if stakeholders are involved, I think we will be able to do everything successfully, 100% for the betterment of our people. My KSA chairman, Kupet and Nat has already mentioned all this. I don't think I need to repeat, but I assure you, as TSC, we came to Navasha. We are partners, and we have a lot of interest in the education sector. We work very closely with the Ministry of Education, with KICD. We have developed a madrasa curriculum which has been approved, and I am waiting for our director to give me more direction. So we launch it, and it will be supplementary to the education of religious education. I speak, I think, on behalf of not only Muslim, but I speak on behalf of the faith-based organization. We are with you. We pray to God to give the right direction, guide you, and give you success. I thank you very much for giving me this opportunity and wish you all the best. Thank you very much for that.
Thank you, the sponsor. Now let's move on. Gentlemen and ladies, I don't have a number of people here to speak, but because of time, we might not speak all of us. I want to give one more person, one group, and from there we shall now interact later on. Once we have time after the responses have been given, most likely you answer might be the response that will come up thereafter. So the abstention, please.
Thank you, MC, our CEO, Daktari Nancy Macharia, Chairman, Teacher Service Commission, the Chairman, COVID-19 Committee, the Director representing the PS, all the other officers around, ladies and gentlemen, good morning. I will not belabor to repeat what has been said, because quite a number of issues raised by Mr. Idimuli is common both to primary and secondary. But I want first and foremost to appreciate the CEO for inviting us here as Capture. We came with a team of leaders, and I would kindly request them to stand. And then we have the National Treasurer, Mr. Kennedy. We have the National Women Rep, Madam Winnie, and we have Executive Member, Mr. Caleb Oduyu, and Mr. Mugo, also an Executive Member. I would like to appreciate Madam for having given us a chance. Today, ladies and gentlemen, outside this hall, we have a number of teachers who we have come along with to come and receive the vaccines. So I want to appreciate the TSC and Dr. Willis for having seen it twice to come along with some vaccines to give to our teachers who are available today. I also want to assure the Commission that we as Capture are doing all our level best to disseminate the message to our members who are the head teachers in this country, to ensure that their staff are given the vaccines. We shall still continue doing the same until we achieve our maximum number which we are supposed to have vaccinated. I want to appreciate very much the report which has been presented today by Dr. Daburi for raising very pertinent issues, and I want to believe it will go a long way in guiding our head teachers to ensure that the schools are safe for the children. At the same time, requesting the ministry to continue supporting us financially, as primary schools solely depend on what comes from the ministry. So, Bwana Kibet, as I appreciate the capitation which was done last term, and which I want to believe it was meant for the year which has ended. Of course, we are not today starting from empty accounts. We had something at least from what you factored into our accounts. But I want to appeal that going forward, it is good that these grants are factored into the accounts of the schools before the schools open, so that as we open with something to ensure the environment is suitable for the young babies who we take care of. I want to take this opportunity again to encourage the head teachers who are here and those who are out there to strongly advise the teachers to, one, receive their vaccines, and two, settle down as quickly as possible. For we already know that the calendar has been shortened, and therefore we have to cover what we are supposed to cover within the given time. I want to appreciate the ministry and KICD, Professor Charles, because I want to make it clear here now that all the schools have already received grade 5 books. So as schools open today, all the children will find the books in school. So I want to appreciate that action which was taken very promptly. Thank you very much. May God bless us all.
Thank you. Los chicos míos, hubo falta. ¿Qué más que es? Hubo falta, sí. Vamos a ir a la hubo falta. Yo le digo,
Commission Chair, CEO Nelson Bajarian, esteemed stakeholders, all protocol observed. Ladies and distinguished guests and gentlemen, thank you for inviting the National Parent Association to this important forum. Today, we are reminded of the special class research education delivery process. Looking at the outputs of this survey and looking around the room, it must be admitted that research is an expensive undertaking. And as a survey finding will show, the absence of research is a way more expensive than research costs and quite harmful to our efforts in realizing education goals in this country. Over the last 1 year, a lot of effort has been placed in supporting learners and learning institutions cope with the fighting COVID-19 pandemic. Both public and private partner resources have been mainly targeted at children and schools. In general, it is reassuring to note that this time teachers have been remembered and their preparedness will be a central subject in a key education program such as this. As parents, we are also interested in knowing that our teachers are well prepared to discharge their special role of training, guiding, and molding our children. Indeed, third second, the Basic Education Act 2013 mandates the association to 1. Explore ways to motivate the teachers and learners to improve their performance in academic and extracurricular activities. 2. Discuss and recommend measures for the welfare of the teachers and learners. And 3. Maintain good working relationship between teachers and parents, among other things. And on that juncture, I want to mention on school fees. My colleague, chair of principals, Dimuli, mentioned, and I'm pleased because we sometimes meet with him in the shows, the radio shows. Today in the morning from 6:30 I was in radio system explaining to parents on the new fee schedule and they have maintained the application. So I'm promising today these functions that we are going to clear all our fees arrears as parents in this country. Number 2, I'm appealing to all the parents, my fellow parents. You
them to stand.
What we are against as parents is the emergence of new extra levies. They have been baptized into many names. They are called the medium, exam fee, admission fee, activity fee, motivational fee, and most of them parents pay without receipts. That is why we are totally against. And we have presented to the ministry our findings. Wherever we meet our parents, we have over 10 million in this country. And the only place we can meet with them is the radio shows, the vernacular radio station, the regional radio stations. They give us through WhatsApp the fee structures. As we speak now, we thank the Ministry of Education for giving us a way forward. We now have a 2021 fees guideline. We will not allow parents to use the school's fees structure that were different from each school. Now we have 5,000 for national schools, and the rest is 9,000. And we will clear we will clear that. That is our mandate. The National Parent Association is interested in findings of the survey, not only to know the true situation of the teacher and preparedness, but also to understand what is expected of the parents in addressing any challenges and promoting readiness. Sustainable Development Goal 4 on education and the dedicated targets SDG 4 recognize teachers as the key achievement of education 2030 agenda. Teachers-learners relationship, which is crucial, the realization of this goal is far more complex than a simple employment relationship. It is hard to speak authoritatively on this subject before hearing the feedback of this important survey. But allow me, distinguished guests, to draw from the supported events that inform us of the preparedness that we are here to discuss. Teachers, as members of our community, are affected by everything that affects other professionals in various fields. Environmental circumstances such as insecurity, host mobility. In spite of all this, ladies and gentlemen, we need each other in this mission. As parents, we want our children to have the best education. We can go to great lengths and make enormous sacrifices to ensure children achieve this objective. Those who remarks, I want to request, because the representative of CS is here, but I bet that we have proposals as parents. And these proposals take a long time to be approved. We want to build some 2 extra classes. We want to put up a dome. We make a proposal in school. We agree as parents, but it takes a lot of time to be approved by the ministry. So we want that to be approved so that our relationship between us, parents and teachers, will be more enhanced. Because I know when we build an extra class, we make more friends. So those few remarks, thank you very much.
And now I have the program, the chairperson. Thank you.
Yes. Kindly allow us to give the report for the state. The stakeholders, who are very key stakeholders. Then we continue in a very short while. Kindly.
We are giving the report, this order, Minister of Education. Minister of Education, okay, the report is here, given to the CEO by our chair, is given to the Ministry of Education, and gives the chair once of the Minister of Health. Then we have the Minister of Interior. Minister of Interior, Mr. Michael, please. Deputy Secretary of the Hearing. Union, Health Association. Health Association. Prepare the notes for that information. Prepare the note, it's your chance, please now. Next, we have the preparedness together. Asante sana the unions, wamepata report of the survey together in a very good way. Wapigiwa makofi tena. Asante sana kwa hiyo ripoti ambayo inaonyesha jinsi tuko tayari kutumikia wana Kenya kwa hali na mali kama shule. Asante sana the program Chiro.
Let me request now, in the interest of time, we have the Special Schools Heads Association, and kindly 2 minutes, don't repeat what others have said, with all due respect.
Thank you very much, Chairman, the CEO, the Minister of Education, and all protocols observed. My name is Peter Sintiene. I'm the National Chairman of Special School State Teachers Association. I've come with my members, the National Treasurer, Madam Salome, and then the National Vice Chair, Mr. Machare. When a chairman, I want to first appreciate your acknowledgement of the special schools, and of course, your invitation for us to be in this meeting. I say so because we are a family of very small people, maybe very few people, which in most cases sometimes we have forgotten. But I want to say, TSC, you are very special people, you have remembered us. I thank you. My point actually is on the issue of the teacher-pupil ratio, which I want TSC to kindly consider, because we have a special teacher-pupil ratio as per the special needs children, and I want to request that it be relooked, and I want to request kindly that the teachers, most teachers, especially in primary schools, most of them are aged. When the employment is done for the new recruits, it's always done for the secondary schools, but not in the primary schools. So I want to request that will be relooked so that we have enough teachers in our special schools. Actually, what we always get is the transfers from the regular schools to special schools. But whereby the Kenya Institute of Special Education is releasing teachers, most of them go to regular schools. So I have to request kindly that they be posted to special schools. Secondly is on the issue of the funding. This one goes directly to the Ministry of Education, because we want to cover the syllabus. And covering the syllabus, we have to go in tandem with the grants, because we need funds for the same. Actually, we receive funds, the FPE, and we have also the grants for the SME. Usually, the FPE comes, but the grants for SME delays, which I want to request that it kindly be